Oftentimes, the oncologists only focus on the tumor, the cancer itself, and not the person with the cancer. And a lot of people go through their traditional treatments, the standard of care, which is chemo, radiation, surgery, and some kind of hormone therapy if you have a hormone sensitive cancer. They go through the treatments and they're told that we don't see any more cancer. And so people go off thinking they're okay. But really, they get hit with another cancer diagnosis, either of the initial primary cancer or a secondary cancer later in the future. So, what needs to be a part of the discussion with cancer treatments are, what do we do? So what does a patient do to prevent recurrence? It's anxiety provoking. You have to live your life. Most cancer patients live their lives with this in a state of anxiety, not knowing when a cancer is going to come back. And the current recurrent rates can be higher for certain types of cancers, such as breast cancer. So, what do you do to prevent recurrence if you've had a history of breast cancer? So, the first and most important thing is, excuse me, you have to address the comorbidities that are usually precede the actual diagnosis. So, when a person gets breast cancer, there's usually a lot of things happening in their health before the diagnosis. And so these are comorbidities. So some examples of comorbidities that I see in patients that go through a breast cancer diagnosis. Oftentimes, there's a vitamin D deficiency. Vitamin D, we often know it as a vitamin, but it's also a hormone, and it plays a role in and activating certain anti-inflammatory genes. It plays a role in the immune system. It plays a role in virtually every system of the body. And women who have low levels of circulating 25 hydroxy D tend to be more at risk for breast cancer. And so I actually see this a lot on lab work when women come to me with breast cancer. All of them are not. So there's a difference between vitamin D insufficiency and deficiency. These women are deficient. And when I mean deficient, they're less than 10 nanograms per deciliter. So that is extremely low. If you have a vitamin D level of 7 or 10, that is concerning. And so these women tend to have, women with breast cancer have a lower level of vitamin D. And so if you want to prevent a recurrence, you're going to have to address the vitamin D deficiency, optimize vitamin D levels. I like to see vitamin D levels in the 80s to 100. That's what you want to aim for. And I don't care if you don't have a history of breast cancer. This is for people in general. You need to have a vitamin D level around 80. If you're in the 50s, that's good, but let's get it up closer to 80. If you have an autoimmune disease, which some of the breast cancer patients do, 80 nanograms per deciliter is exactly what we're looking for, what we're aiming for. So get that vitamin D optimal. The number two thing that is a existing condition that comes along with a person with breast cancer, and it's definitely something that has to be addressed if you want to prevent recurrence, and that is central adiposity, that truncal obesity. So if you have in the midsection a lot of abdominal fat or visceral fat or a large waist to hip ratio, that's very concerning. And it's unfortunate that oncologists do not talk about these comorbidities or even make that a part of the approach to addressing cancer in general, and in particular breast cancer. If a woman has obesity, if she has that extra belly fat, that a weight management program should be a part of the treatment for breast cancer, because inside our fat tissue, there's an enzyme called aromatase, and we can produce more estrogen. So women who have central adiposity, and where they have a lot of belly fat, they're producing more estrogen. And oftentimes, the women who come to me with breast cancer have ER positive breast cancers. And so we have to deal with the obesity. We have to get women into that healthy BMI range, lower the waist to hip ratio, so that their bodies are not producing excessive estrogen. And so that's one of the other things. If you want to prevent recurrence, you have to deal with the weight. And unfortunately, the oncologists are not concerned with that. They're only concerned with the tumor, and that's it. Not what created the cancer, but the aftermath. Now that you have cancer, we have to address the cancer, but you have to have someone on your care team that's going to give you a health plan, not a disease focused plan like the oncologist, but you want to deal with the internal terrain, the environment that created the cancer to begin with. And that is not the goal in traditional oncology. The number three condition that needs to be addressed is the inflammation. So, breast cancer has an inflammatory aspect to the pathogenesis, as do most chronic diseases. So, you have to address the inflammation. And you can easily check your inflammation markers by looking at your HSCRP and ESR. Ferritin is also an inflammatory marker. Get in the habit of checking the inflammatory markers and get an idea of if there's inflammation, systemic inflammation, because when there's inflammation, then that also fuels the cancer. And so you have to get the inflammation under control. The other condition that you have to deal with is insulin resistance. A lot of women who come to me with breast cancer have too much sugar in the blood. Okay. So they're either pre diabetic or they have type 2 diabetes. There's some kind of insulin resistance, and you will not be able to prevent a recurrence if the environment is not changing. You have to optimize your metabolic health, and metabolic health includes your blood pressure, includes your blood sugar, your lipids. A lot of the women who come to me have dyslipidemia or abnormal lipid chemistry, excess triglycerides or high LDL cholesterol, and they're pre-diabetic with the inflammation too. So this is a recipe for disaster. And when I meet with all of my breast cancer patients, the oncologist is not talking about how are we going to address the insulin resistance? How are we going to lower inflammation? How are we going to optimize your vitamin D levels? How are we going to get your weight to a healthy range? No one's talking about that. And so that's why the cancer comes back. That is why, because no one's addressing why it came in the first place. Okay. And this is one aspect of it. This is a mouthful. I'm creating a checklist for you guys so you can have it, just a nice summary that will summarize all of what I'm talking about here so that you can print it out, hang it up, and just use it and have it available. So those are comorbidities that have to be addressed. The next thing is lifestyle. So dietary practices. There's foods that you ought to not eat. I don't care if it's a breast cancer diagnosis or not, diabetes, whatever. You should not eat these foods. So I'm going to go through the foods you should not eat, and then I'm going to go through the foods that you should really focus on if you have breast cancer or have a history of it. So what we all must do for our nutrition is avoid ultra processed foods. That's a must. You have to avoid foods that are ultra processed. Those are the packaged cookies, the snacks, the candies, all of the foods that if you look at the ingredients list, it's a paragraph of terms, organic chemistry terminology that no one understands. That is not real food. You need to eat whole foods. Okay. You want to cut down the sugar in the diet. So those processed foods are high in added sugar, refined carbohydrates. So I want to make a clear distinction here when it comes to cancer. A lot of people say, I can't have this, I can't have sugar if I have cancer. That's just far from the truth. We're talking about ultra processed refined sugar. So we're talking about high fructose corn syrup, or those the added sugar that is added to foods. You don't want that. Artificial sweeteners, all of those things. You want to avoid that. But plant-based sugar, the sugar that is naturally occurring in the vegetable, the fruit in the vegetable, you're supposed to have that. And I get so tired of this. It's a pet peeve of mine where people say you got to avoid sugar when you have cancer. It's a certain type of sugar. And of course, God did not say avoid eating apples if you have cancer. All of fruits and vegetables that he made, whole foods. That just doesn't make any sense. Where this came from was the idea of when you do a PET scan, there's a little bit of glucose that's added. They use glucose to enhance whatever's in a body. And so there's more insulin receptors on tumor cells than normal cells. And so tumors will take up the glucose. That's an imaging technology. It's not the same when you're eating natural sugars. But you still want to keep the sugar low in a diet. You don't want, if you have insulin resistance, you want to make sure that you're eating foods that are low on the glycemic index for sugar, because your pancreas is already a little worn out. So you have to be a little more specific in how you're eating your sugar. But generally speaking, plant-based sugars, complex carbohydrates, and that's something else nobody talks about. Those are sugars too, but certainly you don't avoid complex carbs, right? People say, I have to not eat my carbs. I can't eat my carbs. That's ridiculous. Simple carbohydrates, complex carbohydrates are fine. You need them in a diet. So if you want to prevent a breast cancer recurrence, you want to focus the nutrition on complex carbohydrates. There was a study that was based out of Yale, and they found that 20 grams of fiber can reduce breast cancer risk. If you're eating 2 teaspoons of flax seeds, because of the lignans inside flax seeds, they can actually modulate proliferation and reduce proliferation of cancer cells and breast cancer. The lignans are also weak phytoestrogens, there's controversy around phytoestrogens, but you definitely need to eat phytoestrogens if you have a hormone sensitive cancer, because let me stress, organic phytoestrogens, so that would include your flax seeds, your soy, for example. Those are totally fine. Fermented soy is actually really powerful anti-neoplastic food. You want to get these kinds of foods in a diet because of the lignans and the phytoestrogen properties, because they can bind weakly to estrogen receptors and block the toxic estrogens from stimulating proliferation. And I also want to make mention of this too, because this is important. Estrogen is not a bad hormone. Okay. It gets like cortisol, it gets a bad name, but these are very critical hormones for physiology. What happens is when there's an imbalance of these hormones, long-term chronic exposure to cortisol or long-term imbalances of estrogen, progesterone, testosterone, DHEA, all of these hormones, if there's an imbalance, that's where the problem comes. But estrogen is very important for cardiovascular health and bone health and neural health. So there's a lot of importance to estrogen. But when you have estrogen dominance, you have too much estrogen, it becomes a problem, and you can consume these foods that have phytoestrogens that can outcompete these hormones and excrete. So that's the other importance of fiber. Fiber binds a lot of the hormones after metabolism in the liver. They get excreted in the fecal material, bound up in fiber. So a very critical component to nutrition for breast cancer is fiber. You have to eat fiber, 20 grams or more. And if you're not into counting fiber, that's fine. If you just eat a plant-based diet and you eat a whole food plant-based diet, you will get adequate fiber in a diet. Okay. Normal evacuation is really important when you're not evacuating, which is another component, very important component to fiber, is that it helps to stimulate bowel motility and it's going to push things out. Women who are constipated, they're not evacuating frequently as often as they should. They recirculate these estrogens. So after all your hormones go through the liver for processing, they get bound up in fecal material. Well, guess what? That this anything that goes through the liver that's being processed and later eliminated, these are toxic metabolites. These are things that need to be eliminated. But if you're not having regular bowel movements, then you're recirculating those toxic estrogen metabolites, and that becomes a problem. So you need to eat fiber for that reason because it keeps you regular, and it has an indirect and a direct role in how it helps with hormone balancing with estrogen and other hormones. And so fiber is critical. The next important food group is the brassica family, your cruciferous vegetables, and I'll talk a lot about cruciferous vegetables, but your broccoli sprouts, your Brussels sprouts, your collard greens. There was a study that looked at collard green consumption and its ability to reduce the risk for breast cancer. Again, this is not something that's talked about with the oncologists. They don't focus on nutrition. They don't think the cancer has anything to do with it, or long-term survival has anything to do with what you put in your body. But that's ridiculous. You have to eat these foods. Cruciferous vegetables are high in several phytonutrients, so sulforaphane and DIM and I3C. And these are particular phytoestrogens that help to upregulate phase 1, phase 2 of detoxification. And I can actually see and have seen in women who have breast cancer, a history of breast cancer, I can see what's happening in their liver. And if the liver is handling their hormones properly, in particular estrogen. So some of these women have a very toxic form of breakdown of estrogen that the liver is just for some reason it's not processing the hormone properly. So we need to support certain pathways in the liver to help these women clear these estrogens. And one of the nutrients for that will be the phytochemicals, not one nutrient, but the phytochemicals, DIM, I3C, and sulforaphane. Fantastic phytonutrients for helping with hormone metabolism in the liver. And these women need this. So if you want to prevent a recurrence, you've got to have the fiber. You want to emphasize targeting brassica family of vegetables, cruciferous. And you want to get, if you can, 3 servings or more. Now, when you have breast cancer, I tell women to eat a pound of cruciferous vegetables a day. And it's actually not that hard to do. Focus on those kinds of vegetables. You also want to focus on medicinal mushrooms. Mushrooms are great. White button mushrooms have been shown to dramatically reduce the risk of breast cancer. And so these are very powerful functional foods that have medicinal properties. So mushrooms, not just white button mushroom, but shiitake, maitake, turkey tail. They've done studies looking at turkey tail and its immunomodulatory effect in women with stage 2 and stage 3 breast cancer undergoing radiotherapy. And these women have they've done very well with mushrooms while undergoing active treatment. And the effects is that with these treatments, it causes immunosuppression. And when you're taking mushrooms, and because of the modulatory effects, we don't see such a dramatic drop in neutrophil counts or just the overall white blood cell count. So these women are able to maintain a healthy immune system while undergoing active treatment. So that's during active treatment, but just imagine what these mushrooms are doing when you don't have cancer or you are in remission, okay? So you have to deal with You have to focus on your nutrition, cutting out the bad stuff, the ultra processed foods, the red meat. There was a study that looked at, I'm sorry, I forgot to mention it, and I have to go back to this. There is a study that looked at heterocyclic amine compounds that are found in fried fatty foods. If you eat red meat, you're frying it, pork, beef, anything that's red meat, and it's processed too. So these heterocyclic amines can accumulate in the ducts of women just in general. And if you have breast cancer, they actually saw that women who have breast cancer have higher amounts of these cancer causing compounds that are found in fried meat, fried red meat products. They're circulating and they concentrate in the ducts, which ductal cell carcinoma is one of the common types of breast cancers that are diagnosed. And so they did not see this kind of scenario in women who were plant based. They did not have these high concentrations of heterocyclic amine compounds inside their ducts. Okay. So you have to cut out the red meat. Drinking alcohol is also a carcinogen and it increases proliferation. It's actually a no. Wine, liquor, beer, anything, you cannot drink absolutely no alcohol if you are a woman who's at risk for breast cancer or you have a history. You have to cut all forms of alcohol out of the diet because it's such a carcinogen. I forget I forget what it is, the organization. That is actually like one of the top recommendations for women who have a history of breast cancer or you're trying to prevent it. You cannot have any alcohol because of the effects that it has on breast tissue. So, yeah, cut all of those things out. And there's another study that looked at fried oil. So, a lot of women who are frying in oil, plant oils, seed oils, it increases the risk for triple negative breast cancer. So it's one of the most aggressive types of breast cancer that's hard to treat. Deep frying in anything fatty like these oils, seed oils, very toxic. And what they found is that it increases proliferation. Okay, increases proliferation, and it actually makes the cancer even more aggressive. So these are the nutrition things you have to do. Okay. Now, I'm going to go into fasting. So that's nutrition. Some lifestyle things that you can consider to reduce your recurrence is to incorporate intermittent fasting or prolonged time restricted, or not time restricted, fasting mimicking. So there's a study that looked at women who fast 13 hours or more have a reduced risk for recurrence. And that's because fasting has impacts on your immune system. It has an impact on cancer cells. So I want to mention this. When oncologists, again, they're only focused on the tumor. That's it. But when you do the treatments, when you go through the cancer treatments, they're eliminating the tumor, but they're not getting rid of the circulating cancer cells, which is why people develop a recurrence later in life, because these circulating tumor cells or little cancer cells that are floating around, you can't pick them up on imaging. So you could do a PET scan, things look fine, like there's nothing there, MRI, whatever, but they're still floating around in the blood, and they're responsible for developing the cancer, either the initial primary cancer or secondary breast cancer. So fasting actually removes them, and they're more active during the early hours, like 3 a.m. in the morning, these circulating tumor cells. So if you're fasting, you're actually getting rid of them. If you're taking sulforaphane, if you're eating a lot of broccoli sprouts or cruciferous vegetables that are high in sulforaphane, the sulforaphane they've shown can actually target these circulating tumor cells, which is fantastic. And there's no conventional treatment that can target these circulating tumor cells. So fasting 13 hours or more can be very beneficial, and a very way of doing easy way of implementing that fasting protocol is to just do time restricted eating. Fast in 16 hours, eat within an 8-hour window, and you should be fine. The fast and mimicking, I'll talk about that, but that's another one that I do for cancer patients and people who have insulin resistance. And that form of fasting, I really like it. What I do for women who have breast cancer and they have that obesity that's attached with the cancer, I will have them do 6 cycles. Some of these women, by the way, have diabetes or they're pre-diabetic. So this is actually something you can use, even if you don't have cancer, breast cancer. You could do this, okay? And I'll go over it because there's a lot of diabetes questions. But fast and mimicking 6 cycles of fast and mimicking. So that will be 5-day fasting using a kit. And this type of fasting is different because you can eat while you're on the fast. In fact, we're going to do that in a couple of weeks as a community. That's what we're going to do, the fast and mimicking diet or fasting protocol for 5 days. And so they send you your meals, you follow the instructions, and you eat whatever they tell you to eat for that day. For day 1, day 2, day 3, there's meals that you eat. And you do it for 5 days, and there's a lot of changes that are happening internally as you're going through this fasting regimen. And then when you're done with the 5-day fast, okay, you resume a time restricted eating protocol. So you go back to how you were eating before. And then when the next month comes, you do another 5-day fasting mimicking, and etc., all the way to 6 months. And that's for people who have insulin resistance. And I like this kind of fasting program because this is for people who have diabetes. If you are concerned about fasting and your blood sugar dropping, this is perfect. You can eat and still fast. And that's why it's called fasting mimicking, because you're still eating, but you're mimicking the effects of fasting. You get to benefit from fasting, the effects of what it does at a cellular level. So I'll have breast cancer patients do that. And you should make this a part of your routine. Fasting should be a part of your lifestyle if you want to prevent recurrence. Okay. Sleep is another one. I'm wrapping it up here, but sleep is another one. You have to sleep. If you're not sleeping and you're sleep deprived, it increases your risk for insulin resistance. It also promotes more DNA damage. DNA damage increases the risk for breast cancer. In fact, most women who get breast cancer are either shift workers because they're working abnormal times when the immune system is at its highest in terms of activity. You need to be asleep so that the immune system can restore itself. And if you're up and about working and you're eating food outside your normal circadian rhythm, that will shift the circadian rhythm and it causes circadian dysfunction, and that will lead to breast cancer. And so these women have higher levels of DNA damage because they're not sleeping. Sleep is very fundamental. And folks, I think we get away with it a lot because when we're younger, we haven't lived long enough to have the insults of life hit us. So a lot of young people practice, they take on these practices and carry it into their adult life. And when you get older, there's a lot of things that just you can't do anymore because age does it does catch up, and we start to lose very important hormones when we reach 40 and older. There's certain hormones that play a role in our cancer prevention, being able to not develop cancer, and one being melatonin. We start to lose our melatonin When we reach our 40s, we start to lose glutathione, which is a very important antioxidant. And we also start to lose our hormones, our estrogen, our progesterone. All of these hormones, they play a role in helping the immune system. And this is one of the reasons why we see age-related diseases creep in as we get older, because there's certain things that we lose physiologically, lose as we get older. And so you can get away with a lot when you're younger, but when you get older, you have to really pay more close attention to your lifestyle practices. And sleep is one that's neglected, because when we were younger, we wanted to stay up and watch movies and eat snacks and all of these things. But then when you get busy and as you get older, just this stuff doesn't fly anymore. You have to take sleep very seriously, because it does age you much faster. And that's one of the reasons why sleep deprivation, melatonin, is the reason why the cancer risk goes up when you're not sleeping, because when you're up, cortisol is your hormone, and it's not supposed to be spiked up as high as it is. Melatonin is supposed to be the hormone that is to get you through the night, the restorative process, rejuvenation. Melatonin is an antioxidant. And so I use melatonin for women with breast cancer. You also have to support natural production, endogenous production of melatonin in your sleep. But if you have breast cancer or you have a history of it, melatonin can be used prophylactically to prevent breast cancer and prevent recurrence. And so we're talking about 20 milligrams of melatonin. It can get up to being about 70 milligrams. If you're going in for mammography, you're going to be up into the 100 milligrams of melatonin. If you're going in for radiation, any kind of radiation, you can apply it topically or take it orally. So I support melatonin long-term use for breast cancer prevention and recurrence, prevention of recurrence. And remember, if you're screening, radiation is never good for the breast. So you get breast cancer, one breast, you remove it, and you develop breast cancer in the other breast. So always protect your breast with 100 milligrams of melatonin the day of your mammogram. Okay, so this is the last thing I'm going to say about this topic of breast cancer recurrence, how to prevent it. We want to get in the habit, all of us, we want to get in the habit of doing testing. Okay, so remember, the comorbidities, the things that usually travel parallel with breast cancer, are metabolic conditions. So you need to get in the habit of tracking your blood pressure, tracking your lipids, tracking your inflammation markers, tracking your vitamin D levels, tracking your blood sugar. You want to check and I'm going to actually go into a diabetes reversal program after this. But we have to get in the habit of tracking blood sugar. And so you want to do those things, and you would want to check your homocysteine level, your ferritin levels. You want to get in a habit of checking other nutrients like your B vitamins like folate, B12, all of these things, your nutrients. Okay. Those are nutrients. But you have to also do early detection testing. I cannot stress the importance of it. It's so important. You have to really get in the habit of doing early detection testing. So what does that involve? So for my breast cancer patients, or any patient that have had a history of a solid tumor cancer, and it's also based on the data, but we have a lot of data on breast cancer and colorectal cancer. But in some cases, ovarian cancers, uterine cancers, this particular testing can be helpful, but the oncologists may not find that there's any utility. But there's a test for women who have a history of breast cancer, or if you had prostate cancer, or if you had colon cancer. There's a test called Signatera. And this is a nice test because what it is, it's actually measuring your circulating tumor cells. So you know how you go out and you get imaging for your breast, or if you have cancer, they do all of this workup using a whole lot of imaging. Okay, that's one part of it. But we need to be checking what's in your blood. So there are times where people go in, they do their screening, they do a mammography, and it comes back negative. Actually, there's a high false negative with mammograms for dense breast tissue. So you can't always rely on imaging. You're going to have to do some blood work. And so this Signatera is a blood test that will measure circulating tumor cells. Why is this important? It's important because you can be told that there's nothing showing up on imaging, but in your bloodstream, you still have cancer. You are not free of cancer until your blood work actually shows that you have no cancer. So these circulating tumor cells, as I talked about, they're the ones that's responsible for recurrence. So there are cases where I've run Signatera on cancer patients, breast cancer, and they've been in remission, so-called remission, for a long time. And then you do the test, you're like, oh boy, you have a high concentration of these circulating tumor cells. So you have a cancer coming back. Well, I just got mammogrammed last week. What happened? Yeah, well, that's because the circulating tumor cells have not quite formed a tumor yet that can be detectable or detected by mammography or MRI. This is what these are cells. They haven't, it takes like, I think 350 million cells for the actual imaging to be the standard imaging to pick it up. So they haven't quite formed a tumor, a solid tumor that's detectable, but they're floating in your bloodstream. So residual molecular disease testing is what you want to do. You want to get in a habit of testing after your treatment. You want to, if you've had lumpectomy, mastectomy, or surgery and or radiation, after you do that, you want to check at baseline before treatment, what your circulating tumor cell concentrations are in the blood. And then after you go through treatment, we want to see your response to treatment. How effective was the radiation? How effective was the chemotherapy? And we can see that in the blood work. If the concentration of tumor cells are still high, that tumor burden is still really high after you've done 30 rounds of radiation, that will be very concerning. That means your cancer is quite aggressive and nothing is working to get it under control. Maybe you've done the treatment, you're done, your baseline looks great, or at least the cancer cells or your tumor burden has gone down, and you don't have any circulating tumor cells. You need to repeat that testing every 3 to 6 months. You need to retest your circulating tumor cell concentration because we need to catch an early recurrence. So get in a habit of testing.